Hi, everyone. So I'm going to talk to you about cannabinoids. And actually, if you could advance to the next slide, please. So I'm going to start with a quick overview of the FDA and the USP. So the FDA is the Food and Drug Administration, and it's the government agency responsible for ensuring the safety and effectiveness of foods, drugs, and supplements. So for medications, they require extensive testing to prove that they are safe, effective, and consistent before they reach the public. This includes cannabis products. Now, when it comes to ensuring quality and safety in medications, the U.S. Pharmacopoeia plays an important role alongside the FDA. The USP is a scientific organization that provides standards on what and how strong a medicine is and decides what information needs to be on the label. So you've seen this symbol before, this USP triangle. It should be on your vitamins. They have legally recognized standards for FDA-approved drugs and dietary supplements, which of course include all FDA-approved cannabinoid medicines. The non-FDA approved cannabis products do not have these legalized standards, so there's some confusion in the guidance on testing and consistency. Because of this, there is no real way to know exactly what is in each product. Okay, next slide, please. It's important to keep in mind that the cannabis plant is complex. The cannabis plant contains THC and CBD, which are molecules called cannabinoids. But cannabis has a lot more than just THC and CBD. It turns out that within the cannabis plant, there have been over 100 identified cannabinoids along with other molecules. So the key takeaway here is that most of these cannabinoids and other molecules have not been well studied. But THC and CBD do have an extensive research history. Next slide, please. So this is what I think is the most interesting part of cannabis. It is a very efficient bioaccumulator and phytoremediator. So a bioaccumulator is an organism, in this case a plant, that absorbs a substance quicker than it gets rid of it. So it absorbs it in faster than it metabolizes or eliminates it. Therefore, it builds up in the plant. A phytoremediator is a plant that's used to clean up environmental pollutants such as heavy metals or organic contaminants from soil, water, or air. These plants absorb, accumulate, and sometimes break down harmful substances, helping to restore polluted environments to a healthier state. In other words, cannabis is used to clean up toxins and other chemical waste from soil, water, and air by absorbing it into itself. Here's an interesting cannabis fact. After the Chernobyl disaster in 1986, cannabis was used as a phytoremediator to help decrease soil toxicity near the nuclear plant. So the key takeaway here is that cannabis is highly efficient at collecting heavy metals, toxins, and contaminants to the soil and air. All right, next slide. So what's stopping those contaminants from accumulating in products that people consume? Nothing. Any of these contaminants could be present in any of these products. So how much testing is done to ensure that the contaminants aren't being sold along with cannabis products? Testing is inconsistent and not mandated. So there's no guarantee that cannabis-based products do not contain contaminants unless they are FDA-approved cannabinoids. It's good to understand the different types of testing that need to be performed on cannabis-based products to ensure contaminant-free products. So there's biological testing. So this would test for types of toxic fungus. There's microbial testing, which would test for other pathogens like bacteria. There's heavy metal testing to look for contaminants that may have been in the water or soil that got absorbed into the plant. There's pesticide testing. If pesticides are used on cannabis plants, it's going to absorb them. And there's residual solvent testing. So solvents are used to extract those cannabinoids from the plant to put them into these products. And these solvents can be harmful. So you want to make sure that those solvents don't make it into the final product. And then there's potency testing. And so that would just make sure that what is on the label, the CBD or THC content that is listed on the label, is what is actually in the product. So another cannabis fact is that nickel was over 2.5 times higher in the leaves of cannabis plants when grown in toxic soil near a mine compared with greenhouse growth conditions. Next slide, please. So this is a study by the Clean Label Project, and it shows labeling inconsistencies. So the study had 242 CBD products, and they were tested for heavy metals, pesticides, and other contaminants. First, let's talk about how the study results show inaccuracy of CBD products and also unexpected THC content. As a reminder, THC is the intoxicating component of the cannabis plant, the part that makes you feel high, whereas CBD is not intoxicating. Over 30% of products were inaccurate in CBD content. Moreover, even though none of the products indicated that they contained THC, 45% of the products had measurable levels of THC in them. But there's more. Not only was there a presence of THC in some THC-free labeled products, but some also had toxic elements, including heavy metals. The top 10 brands averaged 34 parts per billion of lead. To give you an understanding of this number, the action point of the FDA for drinking water is 15 parts per billion. So this is more than twice that in your top 10 CBD brands. I want to point out to you what the American Academy of Pediatrics says. There's no safe amount of lead exposure for children. Even small amounts of lead in their blood can harm their thinking, learning, and brain development. At low levels of exposure, the Centers for Disease Control and Prevention suggest getting kids tested and getting them checked and taking action. In short, any level of lead in a child's blood is a worry. There is no safe level. Next slide. So without FDA regulation, CBD products are highly variable. In short, it seems like products are consistently inconsistent. Levels of cannabinoids differ, and sometimes cannabinoids we aren't expecting are found in our products. A recent FDA report found that out of 147 products, more than half were mislabeled. They either had over or under the listed CBD content on the label, and that many of them contained THC when the label said that there was none. So not only was the cannabinoid content mislabeled, but again, toxic elements were found, including heavy metals, notably lead. Now, there's probably some good actors out there, but we know that there's some bad ones too. But we don't know who is who without the oversight of the FDA. So why do we care? Well, you probably want to know that what you're buying and administering to your loved one, and that you're not putting yourself or anyone else in harm's way. We also know that other cannabinoids can have effects on the body, and we want you and your healthcare provider to know exactly what you're taking. To complete this part of the presentation, I want to take a minute and tell you a story about a patient named Sam. Sam had epilepsy since he was 4. He suffered about 100 seizures per day. His family tried every available treatment and found no relief. After exhausting all options, they turned to cannabis products. The first tincture they tried reduced his seizures dramatically, from 10 to 20 seizures an hour to just 1 an hour. This was a huge breakthrough, a huge relief for Sam and his family. However, the next batch did not work, and his seizures returned in full force. When tested, they found that the tinctures claiming to have a 20-to-1 CBD to THC ratio actually had almost no CBD or THC. The lack of consistency and regulation made it impossible to rely on these products to manage his seizures effectively. Many other patients have had this exact same experience. So in conclusion, I hope this gives you a clearer understanding of the importance of consistency, regulation, and safety when it comes to cannabis-based products. Ultimately, we all want to make informed decisions that put the health and well-being of our loved ones first.